According to IDF, the International Diabetes Federation, about 537 million adults are living with diabetes, elevated blood sugar disease, being the top 6 deadliest disease in the world. By having diabetes and not properly controlling it, you can have other deadliest diseases very easily. Now, let's get straight to the point. You can check your blood sugar levels by 3 common ways. Let's talk about the first one that you can do at home without under a doctor's supervision. That is with a glucose meter like this, where you only need just a drop of blood to test with this device. You can take the test with this in 2 ways: fasting blood sugar or random blood sugar test. The fasting one means you must not eat anything overnight for about 8 to 12 hours and then test your blood sugar with this device. Remember that the numbers that I'm going to show for this test are all going to be in milligram per deciliter, so make sure your results are in the same units. With this test, the optimal values are less than 100, which means normal and you have no signs of elevated blood sugar or diabetes. If it is 100 to 125, then you are likely to have diabetes if this lifestyle continues, or we often call it as pre-diabetes. And if it is 126 or above in separate tests, then you have diabetes, in which you should go to a doctor. Now let's talk about the random blood sugar test, in which if you have 200 milligrams per deciliter or above, regardless of what time you last ate, then you might have diabetes, and below that is normal. But if you test 2 hours from the last meal you eat, it will show you more accurate result. Below 140 milligrams per deciliter is normal, 140 to 199 is considered pre-diabetes, and 200 or above is known as diabetes. And that's all about the numbers that you can check at home. But let's talk about the more accurate ones, the one in which you can know about the past 3 months of blood sugar levels. Yeah, it is possible through HbA1c test or glycated hemoglobin test. This test actually measures the amount of blood sugar attached to hemoglobins, which are important proteins of your red blood cells to carry oxygen. As the red blood cells can be alive for only 3 months, the results are indicating your blood sugar levels over the past 2 to 3 months. So let's see what the numbers are. If your HbA1c test is below 5.7%, then it is considered normal. You have no diabetes. If it is between 5.7 to 6.4%, then it is indicating pre-diabetes. And 6.5 or above on separate tests show you have diabetes. But there are some exceptions in which this test won't show the right result, that they are in pregnancy times and other conditions in which the hemoglobin in your blood is not normal, like in sickle cell disease, so make sure to consider them. Last but not least, we have oral glucose tolerant test, which take place under a doctor's supervision. Firstly, in this method, you will be needed to test a fasting blood sugar levels like the previous one. Then, the doctors will give you a sugary liquid depending on your age. After drinking the liquid about 2 hours periodically, they will take your blood samples and test your blood glucose levels. Commonly, the 2 hours apart results are the same as we see before in random test, as below 140 is normal, 140 to 199 is pre-diabetes, and 200 and above is diabetes. The doctors can take samples frequently with 2 hours apart and see your result to even test the other conditions. The message that I want to include in this video is that don't worry if you are diagnosed with diabetes. With today's modern health infrastructure, you can control it very much. What important is to know that you have it before it damages your body. You cannot take the diabetes medications without a doctor's prescription. You can make the test and show the numbers and results to the doctor, and they will choose the best treatment for you. As the saying goes, prevention is better than the cure. You can simply change your lifestyle to prevent many diseases out there. Here's what to do if bitten by a venomous snake. Stay healthy and keep learning.